Dr. Elaine Batchlor always knew this day would come. On Friday, Los Angeles County officially lifted its mask mandate for indoor businesses, including stores, bars, restaurants, gyms and movie theaters. Although many people will surely continue to wear masks and many businesses will no doubt continue to require them, doing away with the blanket mandate marks a major departure from the hell of sickness and death that has been the past 2 years. Still, Batchlor is understandably a bit uneasy about it. She is chief executive of the South L.A. hospital that, for months, was the most overrun in the county with COVID-19 patients. At some point, she acknowledged, "We have to start getting more back to normal." The number of patients that are hospitalized is way down, including at her Martin Luther King Jr. Community Hospital. But, she added, communities like South L that have been hit hard and disproportionately affected by COVID remain at higher risk. That's why, even as most Angelenos celebrate being able to ditch their masks, Batchlor has started pushing a deeper solution to this still dangerous disease, far beyond the use of masks and even vaccines. As my colleagues Rong-Gong, and Luke Money reported earlier this week, Black and Latino residents of the county's poorest neighborhoods are still getting severely sick and dying of COVID-19 at disproportionate rates. These disparities have persisted even as coronavirus cases have plummeted in recent weeks. And, more importantly, they've persisted regardless of the population's vaccination status. You read that right. According to recent data analysis by all county public health officials, vaccinated and boosted Latino and Black residents ended up in the hospital for COVID-19 at more than twice the rate of vaccinated and boosted white people. Hospitalization rates were even more stark for the unvaccinated, of course, but the disparities remain. That's because ultimately, beyond masks and beyond vaccines, much of the blame lies with the underlying health conditions of the people contracting COVID-19. Black and Latino Angelenos lack preventive care for the simple reason that a disproportionate number live in poor neighborhoods where doctors, nurses, pharmacies, hospitals, even urgent care clinics are impossible to find. Neighborhoods such as Willowbrook in South L.A., where Batchlor runs Martin Luther King Jr. Community Hospital. It's really clear that where you live and where you work has an impact on your health status. It's no different for COVID than it is for a host of other illnesses, L County Public Health Director Ferrer said at a recent briefing.